Mark Schultz here, and I'm broadcasting live on our LinkedIn account. And hey, I'm here today with a family member who's actually my sister-in-law, and this is Betsy Mead. Hi, Betsy. How are you doing today?
I'm good. How are you?
I'm doing great. Hey, Betsy and I are going to take some time, and we're going to do a live broadcast session here today. And you'll find out that the reason that we are is because I feel really fortunate that I have LinkedIn Live access, and it's a resource that LinkedIn has given me that I want to be responsible with. And at this time when everybody's really concerned about all the events in the world and what's happening, I realized that I had an extremely valuable resource, Betsy. And Betsy is the Chief Operating Officer and the Chief Nursing Officer for healthcare managers, okay? And prior to being in that role, she actually was in a very responsible role at a major hospital in the Tampa area. Betsy, what was the hospital that you were working for?
It was St. Joseph Hospital as part of the Baycare family, and I was the Director of Patient Services, which is, in normal terms, is the Director of Nursing. I had 16 units, which included ED observation, dialysis, med-surg, progressive care.
Right. Okay. So basically, you were involved. You were basically running nursing services there at the St. Joseph's Hospital. That's fantastic. Hey, what's your background? What are your credentials? Tell me what your background is.
I started as a CNA in a nursing home. Worked my way because obviously my parents didn't have a lot of money for college, so that's how I paid for my nursing license. I eventually got that. And then I went on to get my BSN and then my master's in nursing. And then about a year and a half ago, I accomplished my master's in healthcare administration. Okay,
excellent. That's great. That's great. Well, hey, listen, the reason that Betsy and I are online today is Betsy is actively involved in, the healthcare industry, and she's a professional in this area, and she has a lot of experience in the healthcare industry. And I know that in these times of concern that a lot of us, we just don't really know information of what's happening, or maybe we want to know some information about how to protect ourselves or maybe our loved ones. And you see, I personally, myself, all my parents and my wife's parents are all aging. And my father is 92. My mother is in her mid 80s. My wife's parents are in her mid 80s. And I realized that, with our family having healthcare professionals in it, it would be valuable to share some information with those of you out there who find yourselves in similar situations. And so, Betsy and I wanted to have a conversation about how to be safe and how to be safe around elderly and different things like that. And so we're actually live. And so if you want to submit any questions during this time that we're live, you just go ahead and put a comment down in the comment area, and we're going to do some live question and answer during our live session. So feel free to ask questions, and we're going to kick some things off though with some questions that we have. So I had a couple of things that I asked Betsy earlier today, is that if you have a loved one that's in a care facility or in an assisted living facility, Betsy, what are some of the things that somebody can do to stay in touch with them? Because I'm assuming that it's not really a good idea to go visit them. I mean, just tell me what your thoughts are on how do I stay in touch with somebody who's in an assisted living facility?
Well, as most of you heard, CMS, which is the Centers for Medicare and Medicaid, have basically said no visitation unless it's essential healthcare personnel in the facilities. Okay. So what we're doing is we're really encouraging you as a family member or a loved one of a resident to reach out to the administrator or the director of nursing of those facilities, because we do have ways to communicate. I know our facilities are equipped with iPads so that you can FaceTime. We're utilizing technology as best as we can, but we're also setting up, if you really need to see that face-to-face, we're setting up window time, as we call it, where you can come, you can stand on the other side of a window, and the resident will be on, within the facility. You can't enter the facility, but at least you get to see them through a window. You get to see how they're doing. And we give you guys both communication devices so you can have a conversation. And it really helps, keep that connection.
Oh, awesome. That sounds like a great way, because I know that for myself is that the first reaction is, oh, I got to stay away from my dad because, he's 92 years old and I don't want to, pass anything on to him. And then I realized that would lead itself to, like isolating him, and he really likes interaction and communication. And so it sounds like, doing something like that, window time or, iPads or FaceTime, that sounds like a really good idea. Have you had people start using that so far?
Yes, they use FaceTime and they'll use window time. We've had them both, arrange it with the facility. It's great because, like you said, as the care providers for these residents, we are concerned about their, social isolating them. We're concerned about their mental health. So we want to encourage families to do the FaceTime. Please come do the window time, because it's really important that they know that you're safe, that they're safe, and that you still have that open communication.
Yeah, that's great. Last night, just in my own home here, I reached out to my dad, and sometimes he struggles with FaceTime, with technology. Like last week, I noticed that he went live on FaceTime, or on Facebook. He went live, and all that I saw was a broadcast of the ceiling. And so actually, Betsy, what I did
That's
last
good.
night,
That's all you saw.
yeah, right, exactly. Yeah, right. Yeah. And last night I actually called him on the phone, and I said, Dad, I said, go over to your iPad and open it up. All right. And so I stayed on the phone, and he opened up his iPad, and I said, hey, I'm going to call you on the iPad, and we're going to FaceTime. And he says, oh, I don't know how it works sometimes, And so I just stayed on the phone with him until it was going, and I told him to slide it, to connect, and it opened up, and then we were able to have a conversation on FaceTime. So between a combination of the phone and of the iPad, we were able to get connected and to have a discussion across the iPad. Yeah, I think that's really good. That's good.
No, we will. I mean, I know at our facilities, we're assisting the residents as much as we can. We'll put somebody right there so that if they do have any technical difficulties,
okay.
We're there to help support them.
Okay, that's really great. All right. Hey, listen, there's another question that I know that people are thinking about now. I live in this. For those of you that don't know, I live in the Seattle area, not in Seattle, but in the Seattle, Washington surrounding area. And everybody knows that there was some facilities, some skilled nursing facilities that were hit hard and impacted, from the virus there. Now, so I know that people think to themselves, is it, well, what's being done to protect people from getting the virus in a facility like that? So, what are you doing? I think, how many facilities are you currently overseeing right now today?
Right now, we have 2 skilled facilities, 2 assisted livings, and a home health that we manage.
Okay, excellent. All right. Now, what is it that you're doing specifically in order to be able to make sure that those residents, stay safe? What is it you do?
So, of course, we started where we stopped the visitation only for essential healthcare personnel. But with any team member that enters our buildings, we are screening them. We're asking them the essential questions, like the obvious, like, have you tested positive? Have you been near anybody that's tested positive? We take everybody's temperature. We document that temperature. We ask them if they have sore throat, dry cough, shortness of breath, diarrhea, or any respiratory symptoms. If they've been in contact with anybody, if they've been involved in a community that has had an outbreak, if they've traveled via plane or cruise. We're asking all the essential screening questions and keeping track of that, and documenting who is coming in our buildings, who they're seeing, just to make sure that we have all of our bases covered, just in case somebody does come back positive with COVID-19. We're also, we're following the CDC guidelines for room cleaning. We've stopped communal dining and activities. We've tried to increase activities that are in the room. When we do have activities, we do them in the hallways where they're 6 feet apart, so that we can keep the social distancing. Hand washing, and hand washing, educating the team, educating the residents, educating our teams on appropriate personal protective equipment and how to take it on and take it off. We're putting a lot of measures in place, and just currently, AHCA has recommended, which is the Agency for Healthcare Administration, has recommended that anybody in a long-term care facility be wearing a mask. So we've implemented that all of our healthcare employees wear masks while caring for the resident, and gloves while doing any actions with the residents.
Okay, all right. Well, those all sound like really good measures. Now, as individuals ourselves, what can we be doing to just protect ourselves? I know we hear a lot of things on the news, and we see a lot of public service announcements and all kinds of things, which tell us what to do. But what as individuals, what should we be doing to protect ourselves, from getting the virus or giving it to somebody else?
I would just say, please follow the recommendations that are out there. I know everybody's like, well, I feel fine and I want to go out, but you have to understand that some people are not displaying symptoms and they have the virus, and it's just a chain reaction, and it's going to affect our elderly. It's going to affect our immune compromised. And you have to think there's kids that are immune compromised. There's all ages. There's people out there that are immune compromised. And it's our duty as healthy adults not to go out and to protect them. Some of the main things you can do, obviously, hand washing. Don't touch your face. Do your social distancing. And really, if you feel ill in any way, you just don't feel right, just stay at home and call your local health department or your primary care provider.
Okay, well, that's all really, really good advice. Betsy, I know that you have a lot of knowledge and you're having some regular, calls with people really on an ongoing, constant basis, trying to get current information about what's happening and how you can adjust or how you can do things better. Is there any like recent information or really new information that's come up in the last couple of days that you think maybe people listening right now might like to hear or anything like that?
No, I mean, just that if you have personal protective equipment at home, bring it to your local hospital or long-term care facility. With everything going on in the nation, there's a shortage, so we need to make sure that we're providing what we need to our healthcare personnel to keep them safe. Just stay at home. I see people on Facebook and they're in groups, they're getting ice cream with all these kids, and it makes me very nervous because especially with children who are healthier, may not display symptoms. And you don't, then they're going home to grandma, they're going home, and that does make me nervous. So just really be cautious of what you're doing. And remember that everything you do has a chain reaction. Everything you touch has a chain reaction. And that is so important.
Yeah, that's really good advice. Now, Betsy, I know you have kids and you're really active in some of their activities and things like that. I mean, how are you coping with that? How do you cope with the kids not being able to do all their regular activities?
We've just been going outside, walking the bridge, and just keeping within ourselves and just trying to keep them at home. Mm-hmm. Because, working in long-term care is really important. I protect myself and my residents, so that I can protect my residents. So I'm really just trying to limit their social interaction with anybody. They're staying at home. They're not, my girls are in competitive dance. They have not been at dance. They have not been at school. They've been doing their virtual school online and doing well. It is a challenge. It definitely is a challenge. My heart goes out to especially healthcare workers because I hear a lot of people doing virtual school, and it's, a healthcare worker comes home and they have to do virtual school. So I feel for them.
Yeah. Well, we know it's really hard, but what I have to say is we really appreciate, the extra measures that you're taking and the things that you're doing and providing, valuable information, to people in the community. But, for all of us that either are aging or that we have parents that are aging, I know it's on our minds. I keep asking myself is that how do I keep my parents safe and how do I prevent from spreading something to them? And so, it sounds like what you're saying is it's really important to just be cognizant of it and to keep our distance. And I get what you're saying. And hey, I have a question for you is, the other day, my dad, he's 92 years old and he really likes social interaction and engagement. And I went over to see him, but I talked to him about 15 feet away from his garden. He was up on the porch. I was out in the garden. Do you think that represents any kind of a risk at all?
No, I think you're far enough away in the fresh air, not touching the surfaces he would touch. Okay. I think that really does put him, at a safer distance. And I know it's hard because we love our parents but we also want to protect them. And as you know, we've had people in our family that have traveled, and I've advised them, do not go to our parents' house. We need to keep them safe. Right. And if you can, try to do grocery delivery for them and, try to keep them at home and not in the stores, and they don't need to be fighting the crowds anyway.
Okay. All right. Well, that's really good advice. Well, listen, Betsy, I really appreciate, your knowledge and your information on this subject. And if I have an opportunity, Betsy and I are going to get back online and share any updates or any additional information. And so for those of you that weren't able to watch this video live, all right, and you're going to watch a recording of it, keep an eye out for my LinkedIn Lives because, I feel like it's a valuable resource that I don't want to waste. And I want to be able to use it to be able to share information with people because many times, we're all just looking for information. And I know that we have the news and we can watch that, 24/7, but I know sometimes, it just feels good when you have the ability to be able to get some information from other sources. And, I'm not a news agency and I'm not filtering anything. And Betsy and I are doing this live right now. And we're going to do some live question and answer sessions going forward. And so keep an eye out for my LinkedIn lives, and Betsy's going to come back on and we're going to answer questions. So I appreciate you watching today. And Betsy, thank you so much for taking time out of your busy day. We know that you're working because you're taking care of people. And I wanted to thank you so much for just being with us today and just giving us a little bit of information.
I know. Appreciate you having me.
Okay. Well, we'll talk again soon. Thanks. Bye.
All right. Thank you.
Yep. Bye-bye.